Bonnie, welcome to Nutrition and Wellness Consulting.
Thank you.
So, can you tell our viewers as to what were your health concerns and what brought you here?
I was having terrible stomach problems. I felt very bloated. I felt weak, tired, and I also had digestive issues where I felt like I wasn't absorbing the food that I was eating. I felt after eating that I was very tired and like hungry all the time and like it wasn't helping me, helping my body.
So, did you have diarrhea, constipation?
Yes, I had terrible, terrible diarrhea. I would eat and within 20 minutes to 30 minutes I would have very painful abdomen, very painful cramps, and then I would have diarrhea.
Okay. And so then once you came here, what did we do here?
I met with you and we did a extensive history, and I filled out a lot of paperwork telling about my symptoms and what I had experienced as far as food-wise and eating and that sort of thing, where I had traveled, and then we set up a treatment plan after having some labs done, and I had my primary care doctor draw some labs as well, and we took the results and set up a treatment plan.
So, what was included in your treatment plan? What did we do?
There was a lot of dietary restrictions based on the reaction that I had that was showed up in the labs, and I followed those dietary restrictions and cut out a lot of things that I had reacted to as my labs showed, and kind of started over from square one and eliminated all those things that were causing me problems.
What was the experience like? Changing your eating habits?
It was, at first it was difficult because you have to learn, how to do all this.
Yes.
You have to learn where to shop and where to get these ingredients, all the organic foods that I was eating. But it didn't take long and I could see the results, so that motivated me to stick with the diet. And now I cook with just exclusively organic foods, and I feel better for it, much better.
And what kind of results have you seen?
Well, I've had weight loss. I've lost about probably 15 or 16 pounds. I'm much less bloated, and my skin has cleared up, as you mentioned. I don't have stomach cramps all the time. I'm able to go out and be in public and not worry about how something that I ate is going to affect my abdomen, my, where I'm at.
Yes, and not looking for bathrooms.
Yes.
And then with regards to your brain fog, I remember the first time that you came, it was you were all over. And tell us about your experience with that and how has it affected your work?
Well, the brain fog was really bad, and I also had headaches with it, and just my body was fatigued, and it all was kind of rolled together, and I didn't realize how bad it was until I started doing the steps to clear it up. But yeah, it was very bad. The brain fog was very bad. I was so fatigued by middle afternoon, and as I did follow the diet and use the supplements that helped me as I recovered, I noticed that the brain fog, it sort of diminished, but it was almost like switching a light switch on at one point, where it was getting a little bit better, and then one day it was just like turning a light switch on and it was just gone.
And you mentioned about how well you could focus on your work and do difficult tasks.
Yes. More recently, I think that I can take on harder things and harder projects for my work that I probably wouldn't have felt up to, 2 months ago.
And I'm so proud of you that when you're talking about eating more of your vegetables and making your soup, and you have taken good efforts here. The other thing that you mentioned is about your asthma and how well you feel.
Yes, my asthma feels a whole lot better. I have less symptoms, and I can breathe easier. It used to be in the winters when I would go outside, as soon as I would hit the cold air, I would immediately start coughing, and I would have to always keep my mouth covered with a thick scarf because the symptoms would be so bad. Now I can actually go outside if it's not too terribly cold without the scarf around my mouth, and I don't cough. And the main thing that I've noticed is I breathe easier.
Wonderful. And then lastly, about your blood sugar levels.
My blood sugar levels have come down. When I first started this program, the diet and the supplements, and unfortunately just before I started with you, I got diagnosed with diabetes. So I had to at the same time start monitoring my blood sugars. And when I first started testing them, they were around 125. And as I've progressed with the diet and eating the right foods and losing the weight, and the whole thing rolled into one, my blood sugars are now down around under 100 some days. So to me, that's significant progress.
Yes, I am really proud of you. I'm
proud of me. It's been difficult. I won't say it's easy, but it's well worth it. And had I not come here and found you, I probably would still be suffering. And I was right at the point where I just didn't know where to turn anymore. I just felt so bad that I just, I didn't know what to do about it. I knew I had to do something. So, and I got your name from a nutritionist, a dietitian, through Special Tree.
Yeah, yes. Jill Fritza.
Yes. I sat with her at a conference, and they served our meal, and I said, oh boy, I don't really want to eat this because I know how badly I'm going to feel after. And then she started, I didn't know she was a nutritionist or dietitian.
She's a dietitian. She's a colleague of mine, a very good friend of mine.
Yes. So I didn't know, that I was sitting next to someone like that. And she introduced herself and, of course, told me that she was a dietitian and suggested that I call you and contact you and that maybe you could help me. She said that was your area of expertise. Yeah. So I took her advice, and here I am.
Wonderful. And so what would be one piece of advice that you would like to give to women like you who are suffering with diabetes, weight issues? One thing that you
don't do it. Do something about it. Get active, get involved, and go to see Artie, go to see you. Go to see somebody that can help you. Don't suffer with it.
Yeah.
Because I suffered with it a long time, and now in looking back, I'm really shocked how long I did experience problems like that. It was at least, I would say, 2 years that I felt probably that bad.
And now you've gained it back. You've regained your health back.
Yeah.
And you're still working on it.
I'm still working on it. Yes. So I feel that I'm going to even be better in another 6 months. I'm going to be even better, and I'm sure I'll be able to achieve some more weight loss goals.
Absolutely.
As I continue on this journey.
Yes.
Yeah.
Congratulations, and you make me so proud.
Thanks,
Bonnie. Bye.